of plastic surgery and are an important part of microsurgery training. This is how I practice mine in my spare time. You get a chicken thigh and you show yourself the nerve and the artery. Usually under this bony part here, you will find a nice nerve, artery and vein ready and awaiting you right there. So you have the main bit of the meat, the bone there of a fillet, and then a nerve and artery right there. And this is how you practice your microsurgery at home. So we're going to do a nerve repair today. I think it's got a pretty nice view. Let's do this. So just freeing up the structures. This is the only channel you're going to see live simulation to help you with your training as a aspiring surgeon. It's definitely one of the perks. And then with the membership, you get access to lots of resources, clinical cases, and the private videos, training tutorials. So we've got our nerve here, we've got our artery here, and it's like a vein over there. How do I know? Well, you know that from our anatomy, veins have a thinner media layer, so we can identify that. Just trying to sweep off all this adventitia off of the vessels and the nerve to help identify them and any branches between them, so that when we do our repairs we have a nice network of structures that are identifiable. So we've got our forceps and our dilator. Our dilator has got the curved body here, whereas the forceps are straight. And if you look at the tips, they are blunt. So just to prepare our structures, forearms on the table. I'm going to switch sides actually. Dilator's in my left, forceps in my right. Just separating off my nerve from my artery. My artery's got a lot of fat around it actually. So I'm going to have to do a bit of dissecting, which is great because you get to see that. So the art of dissection, go in, open, pick it up, cut, use that to leverage to the next one. In, open. If you can see a vessel, you put a clip on it so it doesn't bleed everywhere. But that's our artery there. I'm just isolating it so that you get a nice segment for when we want to practice our simulation. And this is just how I practice my microsurgical skills so that when it arises at work, I'm able. So you can see how I've dissected the front and my side, but I need to the far side, so I'm putting towards me so I can see little branches there, so I'd either clip them or cauterize them, but they're not going to bleed on me in this situation. And that's the artery. Do the same for the nerve. Just free up a nice segment so we can do a nerve repair live on YouTube. I think we're probably the only channel that does live surgical training on YouTube, but our website is really where it's all happening where you get access to resources, one-to-one training, and it's the same cost as a YouTube membership. That's medsyncltd.com/resources. We'll just go to medsyncltd.com to join our community. So nerve, artery, and then vein. Vein needs a bit of work. So as I said, vein, artery. Artery's got a thicker tunica media. That's how we know. So this is just us practicing microsurgery for the community of aspiring junior surgeons, and this will allow them to be ready for doing it in person. If you're watching this on replay, get your chicken thigh, get set up, and practice. So we're going to use an 8-0 suture. It's a very long suture right there, and that's going to be for our nerve. I'm going to show you how I do mine. So let's say we've had a cut. Digital nerves of the finger are this size, so that's why we practice on them. Practice on chicken thighs because they're cheap and easy to buy. Yes, they are animal products, but it's cheaper than buying all the simulation items. But if you don't want the meat products, then you can just buy one of our simulators from our shop. Products tagged below. So you have the front wall, the back wall. You want to line them up. Oftentimes when you get a cut, the fascicles start to pop out, so you may want to tidy up that end. So I'm going to do that now. Just going to take out, so we have a nice straight cut. Nerves grow, regenerate, peripheral nerves regenerate at a rate of 1 millimeter per day. So you want to do a nice close approximation of the epineurium. We're going to do the back wall first, counter traction, and then pull so you get a short end. It's a very long suture, so there's a lot of pulling here. It's a very long suture. Look at that. And we do the other side. So I'm holding it up. Just stitching the epineurium. Show it to myself. That came out, so we'll do it again. I need to do the reverse actually. And it's just an epineural stitch. Let's zoom on that so you can see. So it's just on the outer layer. This is the fascicles, this is the epineurium just on the outside. Elbows against your body, forearms on the table. Put it in the direction which it needs to close, so that way you don't pull the suture out. Part the needle somewhere you can see it, and it's easily findable, ideally not into another vessel. Have a short end and a long end. You use your instruments interchangeably to tie a knot. So this is the normal way, so 1, 2 around the needle holder, pull the short end, hold it a bit closer, they're together, then you pass the long end to the needle holder, and now you wrap around the forceps so that your hands do not cross because it's more economical. And you can see the knot. Because I've got a long short end, I'm going to flick that through like that and tie. I'm going to pass this to my then I'm going to cut the short end first so that my needle is nice and close by. And then I'm going to hold the long end, cut it, and then we can just do ones on the side. So we'll go here, it's just the outer layer, the epineurium. You follow the curve of the needle, mount it early. The rotation is just in your fingers and at worst in your wrist. You don't need to add anything more to that. That needs to go there. Orientation is really key. It's not forceful, it's just rotation. You pull it in line with the, use this as a fulcrum to keep it in line. Again, a very long suture. And this is an epineural nerve repair. If you want to do fascicles because it's a mixed nerve, so motor and sensory, you do a perineural repair. Motor fascicles to motor fascicles. So for example, the median nerve, I think the posterior aspect is motor, and then the anterior is sensory. Proximally in the forearm. As I said, you just pass the long end between the two instruments so that your hands never cross. I'm going to cut the short one first. So sometimes I have a tremor. Just have to work with it. If I've had coffee, worked out in the morning. But life must go on. If you practice enough, you can work against these, or you find techniques to work through these microsurgical challenges such as tremors and working at a height. And then we're just going to do one more on this side, and then we're done for the nerve. Didn't do well. Came out. Slightly longer bite, but not deeper. Leave it alone so I don't cause too much trauma. Follow the curve, put it down, then I'm going to mount it straight away. He says, over there. Do the opposite side. So counter traction. See how I let it go? If I grab it through here, it gets caught in the loop, so I'm going to put the loop away and then follow the curve of the needle. Pull, make this a fulcrum, so I'm pulling it in line with the nerve. Short end, long end. Leave the needle somewhere I can see it parked. Because the short end's over here, I'm going to wrap it around the forcep so that my hands don't cross. 1, 2. Notice this around the tip. Now around the needle holder. Bring it into view. And then around the forcep again. If you're getting value out of this, like it, subscribe, become a member, share with medical colleagues that are interested in microsurgery. This is an essential skill as far as I'm concerned. For surgeons, the more you know, the better. And you need to practice early. If you want to learn how to set up your own microsurgery simulation at home, I will show you in the members area in 10 minutes after doing this repair. So I'll prepare the artery. You've got the cut, you have your clamps on it, you go in the lumen, pick up the adventitia with the forceps, go in, open, rotate, come out, it leaves the hole there, you then flush it with heparinized saline. Do the same with the other side. Okay, and then we get like a 9-0 suture, which we're going to do now. So slightly smaller on the vessel, going with a 9-0. Again, when we're talking about needles, we've got the strength required to break it, which is 9, so that's not much strength. It's black, it's round bodied, its length is 5 millimeters in terms of the length of the needle, and it's 3/8 of a circle. So that's the whole circle, it's 3/8 of the circle. It's round bodied, so when you pass suture back and forth, it won't cut itself. So, and it's a monofilament suture because it's nylon. Comes like this. And it looks like this, really, really tiny. So let's zoom in. Back wall is always the hardest, so I tend to start with that, if I'm honest. So dilator and needle holder forceps can go away. Now I'm in, I put my dilator inside. Come through. On to early. That was the back wall suture. So you want to do this one now. And through. And pull in the direction of the vessel. Let that come out of the way so you can see. Long end, short end. We're here. So same thing, you don't want your hands to cross. So 1, 2, grab the short end. I'm going to turn it upside down so that it's easier to take. Need to clean the tips of my forceps, my instruments, because things are slipping a bit. So let's do that. I mean, it was 10 minutes on the nerve, and this should be like another 15 minutes on the artery. Surgery takes time, but that's why you practice, so that it doesn't take too long And that's why we make these videos for aspiring surgeons and junior surgeons, so that they can learn the techniques and practice in their own time in the same way. And then I go either side of that suture at the back. The key is to make sure you do not catch the other side of the wall. That's where the dilator goes inside. I can see that I'm not catching the other side, but the bite's not so great. That's a better bite. And then, so that I can get a good angle, I'm going to do it in 2, but you could equally do it in 1 if you had a better position or more flexible wrist than mine. And I want that side bit just there. You can do it in 2, follow the curve, like so, and then pull the suture, like so. Short head, long end. Park the needle somewhere where you can find it, out of the way, so the curve of the suture is like this. And then we're going to tie. If you're getting value, like it, comment, and subscribe. If you are an aspiring surgeon, a junior surgeon, become a member, medsyncltd.com. Become a member, you get access to these free lives, the members only lives, and the free content. Alternate the instruments. And then you cut. You can leave one long and use it to turn the thing, but I'm confident that will be fine. We're gonna now get a bit of light. And there. So it should be quite bright to see what I'm doing. So now would be a good time to reflush your lumens with heparinized saline and the area around it, so that you can make sure your sutures are nice and well placed. Like so. So now I'm going to do the side closest to me. I'm going to try and do it in 1 because I can see the other side. And then push it through. And what we're going to do, that's different to maybe when we've done it before, is we're going to do a continuous suture, because I think it's just one more stitch on top, and often you want to see, if I tie it off now, it'll be difficult to see the front and the back wall when I do the final suture, so I'm just going to do the final suture now, and then tie it off. Whilst I can see, I would flush the hep cell before doing this. Heparin saline just to wash out any blood clots. See the tip before you go across. Leave the loop, park the needle, short end and a long end, seal. This needs to tie to this, so we shall do that. The other option is you cut it in between where you've done the two sutures and then tie them separately, but we've done that in previous videos. I'm showing you the other technique where you do a continuous suture for the last one. And then tie with the loop like you would like a continuous suture at the end of a skin closure. Don't get caught in the loop. Cut the short, cut the long, and then tie these two together. And this is how you practice your microsurgery at home. Members, I'm going to show you how to set up your microsurgery with just your phone and a phone stand in the members only area. So if you're not a member yet, subscribe and then register for the membership, and you'll get access to that video and the many other private members only videos that are available. So this is incorrect. I need to wrap it around the forceps to bring it this way. So 1, 2, the surgeon's knot, nope, that didn't wrap. 1, 2, surgeon's knot. When you're testing your vessel flow, you let off the distal clamp first so that backflow comes first. It's under lower pressure, and then if you've got any bleeding points, you can place that suture without putting clamps back on, or the clamp back on. Whereas if you let the inflow back through, it'll be under slightly higher pressure, so it'll be harder to place the suture easily. And that is our arterial repair. Arterial anastomosis, nerve coaptation. Shall we have a look? Looks decent. Maybe an extra stitch there. Yeah, let's do that. Because there's a gap. This is where it gets tricky really, because you haven't got the direct field of access. So it's easier to kind of do it when you're going through. Just one more suture in there, in that gap. So before I go across in one, see the tip, which I can see there, and go across to there. Let go. Put it through, make the fulcrum there. And then tie. Tips are down so I can grab it easily. 1, 2. Because of the angle this is in, it doesn't really matter which way I tie, because I don't cross my hands. Bring the loop out. and tie. If you liked what you saw there, this is how we repair digital arteries in the finger. They're this small. This is how we do all kind of microsurgery, and this is how you practice. So, nerve, artery, vein. For the members, I'm going to show you how to set up your own microsimulation with just a phone, just a smartphone, and as the microscope, and a chicken thigh. So if you want to learn this, become a member, and you'll see this video and so many more high yield skills videos that are not available to the general public. See you next week, everybody else.